This new invention will contribute to alleviate the suffering of patients. It will also reduce anxiety accompanying the dental visit, which may prevent them from receiving treatment at early stages of dental injuries or diseases, which makes it more difficult to treat in later stages. What is DimOba syringe? This invention is considerably modified from the traditional anesthetic syringe used in dentistry for over 100 years. This new anesthetic syringe is designed to apply topical anesthetic gel and tissue pressure before introducing a needle into the tissue, and can perform local anesthesia without viewing the needle, which facilitate dental treatments conventionally and without pain. Components of DimOba syringe. This dual-action syringe consists of an external body having a distal end defining an anesthetic gel receptive concavity surrounding a needle passage through the distal end. The external body also includes a proximal end defining a plunger receptive passage. An internal body is able to slide forward and backward inside the external body. The internal body receives a needle in a distal end of the internal body and an anesthetic carpule to provide fluid flow communication between the carpule and the needle in response to pressure on the plunger. The use of DimOba syringe. This syringe can apply topical anesthetic gel before introducing a needle into the tissue. The topical anesthetic gel is accurately applied on the tissue and only on the area of puncture and injection. This syringe can exert gentle tissue pressure by its blunt smooth head on soft tissue in the area of puncture for 1 minute. An internal body is able to slide forward and backward inside the external body. The internal body receives a needle in a distal end of the internal body and an anesthetic carpule to provide fluid flow communication between the carpule and the needle in response to pressure on the plunger. The use of gentle pressure to the injection site before and during the injection will reduce patient pain by producing a dull ache to block pain impulses arising from needle penetration. Pain reduction mechanism. This syringe concept applies the famous theory concerning how pain works, which is called the gate control theory, devised by Patrick Wall and Ronald Melzack in 1965. This theory states that pain is a function of the balance between the information traveling into the spinal cord through large nerve fibers and information traveling into the spinal cord through small nerve fibers. The large nerve fibers carry non-nociceptive information and small nerve fibers carry nociceptive information. If there is more activity in small nerve fibers, then there will be pain. However, if the relative amount of activity is greater in large nerve fibers, there should be little or no pain. Advantages of DimOba syringe. Regular needles and local anesthetic carpules. This invention does not require special needles or anesthetic carpules. The irregular needles and local anesthetic carpules can be used, which is available in any dental office. More accuracy in applying anesthesia. This syringe can apply topical anesthetic gel before introducing a needle into the tissue. Due to the concentric arrangement of the needle and the concavity holding the gel, the topical anesthetic gel is accurately applied on the tissue and only on the area of puncture and injection without the needle for additional procedures, such as carrying the topical gel on a Q-tip. Simultaneous local anesthesia during needle insertion. The innovative syringe helps in reducing pain during injection, as it allows simultaneous local anesthesia drops to seep into soft tissue during needle insertion. Needle is invisible. This syringe helps in overcoming fear and anxiety associated with seeing the needle before and after injection. Patient safety. Prevent patient accidental injury, especially children. that could happen to the lips, tongue, or other soft tissues in the mouth when carrying dental syringe into the patient's mouth. This needle is extremely safe to use. Medical and dental personal safety. It eliminates the possibility of needle to accidental injuries to medical and dental personnel, thus preventing the incidence of transmitting dangerous communicable diseases such as AIDS and hepatitis. Multiple medical uses. The concept behind this innovative syringe can be applied to other medical use, preventive immunizations, ophthalmology, and dermatology, etc.